The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Welcome, TMD Warriors. We are gathered here for the next episode of TMD Demystified, and I am Tony Urbanic. Today, we're going to tackle the topic of interprofessional practice and TMD, TMJ. You can call it TMD, you can call it TMJ. Around here, we call it jaw joint problems. That is not what we're going to talk to, making the distinction between the two monikers, which can be made. What I'm going to tackle today is talking about interprofessional relationships between dentistry and medicine, and that relationship on the topic of TMJ problems. And there is quite a relationship, and it's getting stronger in dentistry. As you know, I ride both rails, dental, medical. They're different rails. The track in dentistry and medicine has never been the same. Fortunately or unfortunately, I got to experience both, and that would be another. I could put several episodes together just on discussing the difference between dental education, medical education, dentistry as a profession, medicine as a profession, the distinctions between the two, how they have not been coordinated. That would probably be a good topic, but doesn't relate specifically to TMD, which is my overriding topic for this podcast, TMD Demystified. But there is quite a needed and significant change in dentistry, which is occurring right now. And for the older dentists like myself, who may not be aware of it or may not recognize it, I encourage you to do a little reading and pay attention. For the younger dentists out there, I think you're much more aware of what is happening as far as the increasing opportunities for technology of various kinds in dentistry, how that is changing the patterns of dental treatment, of dental education. TMD has a major part in that, even though you may not be aware of it, which is what we're going to talk about today. So let's kind of define what I mean here by interprofessional practice, and then make it more specific to how it relates to TMD. So interprofessional practice can be generated and described in dental terms, in the dental profession, in the dental industry, as the relationship between the general dentist, the vast majority of dentists are general dentists, and the much smaller majority who are specialists, and the relationship between the dental generalist and the general specialist, and the relationships, interprofessional practice between them. And for my entire 50-plus year career, it has been, the specialists rely on the generalist for the most part to refer them patients to practice on. That relationship or set of relationships is certainly still strong and still present, but it is somewhat changing from in one area or two, that the DSOs, and that is really one of the major causes of the changes that we see. The DSO industry within dentistry is getting much, much stronger and much rapidly stronger. and bringing in dental specialty organizations to either compete or to augment the general dental DSOs, dental service organizations. And those business models are changing like on a daily basis, and new business models arriving. And again, I don't mean to confuse anybody, but that particular interprofessional practice is the relationship between the general dentist and the specialist. Now, the medical, of which I'm very familiar with, the medical profession and the medical industry has used that model of specialist and generalist over the past half century or more quite differently. It was certainly very active and effective 50 years ago in the training of medical doctors, where you would get your medical degree, which basically gave you the right to go on to further education. Your medical degree wasn't much good at all until you took up a certain area of practice. And then, of course, there were general medical doctors, which we now call PCPs, or family practitioners. And they're subsets of those that do not hold a medical degree, but hold a physician's assistant, or nurse practitioners, primarily physician's assistants, who do most of the day-to-day routine work for the medical doctors who are generalists, and then a whole plethora of specialists within the medical industry and subspecialists within the medical establishment. For example, heart disease has several subspecialists. Radiology has, 50 years ago, if you're a radiologist, you read an X-ray, you held it up to the light, put it on the X-ray view box and read that. That's how you did it. And now there are multiple types of radiologists, subsets, which are used by the generalist in medicine to properly triage a patient to get into the system and have those specialized in that specific area do their examination or diagnosis or treatment in the most expedient and the most effective and the most cost-effective manner. Now, that medical model, which I just described, is soon to be coming to the dental industry one way or another. Maybe not quite as rapidly as happened in the medical industry, but it is happening as we speak in the dental establishment. So that is one particular concept of interprofessional practice, where the generalists either refer or triage their patients. Right? A good distinction. In the dental industry, it's a referral. In the medical industry, it's a triage, because the general medical doctors, they know what they treat on a routine basis. The specialists don't want anything to do with what the generalists treat on a routine basis. And in the medical industry, they are just triaged on. In the dental industry, it's the general dentist, depending on his own chutzpah or his training. He may or may not be adequately trained to do a lot of the things in dentistry that he will take on. But obviously, the smart general dentist will do what he does well and do it routinely and refer the things he does not do well to the specialist. But those are just two distinctions. The primary distinction that I would like to make for this episode is the interprofessional relationship and interprofessional practice between the dental profession and the medical profession. So you have your interprofessional relationships in the dental profession, in the medical profession, and now very rapidly, as I see it, there is becoming a interprofessional practice and interprofessional relationships between the medical industry and the dental industry, between the medical establishment and the dental establishment, between the medical profession and the dental profession. And that is most commonly seen or recently seen, or most visible, I guess would be the proper description of it by what has happened and is happening at Pacific Dental. Pacific Dental Service, which is roughly 1,000 integrated, networked dental offices, primarily functioning on the western half of the United States, but spreading rapidly throughout the rest of the country. And that organization was founded and now headed by Stephen Thorne, who is the CEO. And recently, within the past 18 months, Mr. Thorne, who is not a dentist, his father was a dentist. He actually got into the business by managing his father's practice. I don't know how many years ago, but must have been several, and developed it into Pacific Dental Services. But Stephen Thorne has individually been promoting, and I think rightfully so, the mouth-body connection. And he, whether it be, I'd love to meet him sometime and find out exactly why and how he came up with this concept and is now promoting it. It really is nothing unusual. I mean, anyone could have looked at the situation years ago and said, hey, the dentist area of expertise, the mouth and related structures, is just another part of the body. But historically, unfortunately, and I do mean unfortunately, I think dentistry was sectioned off, either intentionally or unintentionally, by the medical establishment and considered by the dental establishment itself, and certainly the patients, as a unique and distinct profession from other professions that handled treatment, evaluation of the rest of the body. When actually, dentistry is just another specialty of medicine, actually, or whatever you want to call medicine. Treatment, examination, diagnosis, and treatment of one's body would be a better description, which includes what used to be called medicine and used to be called dentistry. It's one body, and the coordination and the interprofessional dialogue and communication between those two professions has not been good. In fact, it has not existed because it's considered by both professions and the patient and the public at large is not being connected. And there is a huge connection. If you just think about it, this is just another part of the body, and a very important part of the body, extremely important part of the body. And I won't go into why it's so important and the different diseases that are associated with the oral cavity and related structures. But to his credit, I want to say that Mr. Thorne has done a great job in a very short period of time as promoting the mouth-body connection, and now has actually begun to coordinate dental offices with medical systems and medical offices, combining their practice management programs, so that the practice management program for the medical system and the dental office are combined as one, so that the medical practitioners and quote dental practitioners quote can coordinate their notes and the drugs and everything, so that it is basically within their one system. And on the West Coast, in and around Los Angeles area, as I understand it, has partnered with a medical organization called Memorial Care Healthcare, and is placing dental offices within Memorial Healthcare offices simultaneously and building out this system as a medical dental healthcare management system. Though we're getting to the point here that I'd like to make about this whole progression of examples, in that the best example that is used by Mr. Thorne and Pacific Dental, and the most obvious relationship between oral care, oral health, and the rest of the body is inflammation associated with periodontal disease. And that in recent papers that have been promoted and published by Pacific Dental, which I did not fact check, but roughly, I think it was roughly 45%, or could be more, 60% of patients in the United States have some form of periodontal disease. Of course, we all know what periodontal disease is. It's inflammation within the periodontal structures, periodontal ligament, destroying the periodontal ligament, destroying the periodontium area, leading to, bacteria infiltration, infection, and tooth loss eventually. Periodontal disease, but is generated first by inflammation in and around the teeth. And that's, of course, all of our hygiene activities are focused on cleaning and decreasing the inflammation within the periodontal area, which would then limit periodontal disease. Well, it has been in the literature for many, many, many years, the relationship between inflammation generally throughout the body and inflammation in certain types of diseases. The most common and talked about are diabetes and heart disease. Cardiovascular disease, obstruction of the coronary arteries is primarily a disease of inflammation of the coronary arteries first. You cannot get coronary artery obstruction unless you first have inflammation of the coronary arteries. And there are very good, a lot of studies that were promoted and promulgated 20 to 30 years ago on the relationship between periodontal disease and coronary artery disease, which have proven to be accurate and true. So with that being the fact that inflammation coming in and around and from the oral cavity has a profound effect on diabetes, heart disease, and others, then it would stand to reason that inflammation of the temporomandibular joint would have the same effect. Inflammation is just inflammation. And I have promoted and said many times and several times on these lists of episodes and podcasts on TMD Demystified that, in my opinion, now the next thing I'm going to say is opinion, I firmly believe that when we know everything we need to know and can know about inflammation, that will give us the key to solve cancer of all kinds. Because inflammation is a broad topic. We know a lot about inflammation, and then there's a lot that we don't know about inflammation. But the point is, inflammation is the body's response to damage, any kind of damage. If you have damage, it creates inflammation as the body's mechanism to begin healing. That is what inflammation is. The body's mechanism to begin the system and the process of healing. And if it doesn't heal completely, then you end up with a plaque in the coronary artery, which obstructs the artery eventually, and you have an infarction. And in periodontal disease, if the inflammation is not handled, then you get bacterial infiltration and more inflammation, and eventually loss of enough periodontal structures and support that you lose a tooth. Now, the same concept handles or associated with temporomandibular joint disease. As it works out, and I have done the mechanics of indirectly measuring the surface areas of the temporomandibular joint, internal surfaces area of the temporomandibular joint, including the superior joint space, the inferior joint space, and the surfaces of the meniscus, and the lining of the joint, temporomandibular joint. The lining of the temporomandibular joints is greater than the entire surface area of the periodontium, periodontal ligaments, if you will, of 28 teeth. In other words, what I'm trying to say is there's more potential for inflammation surfaces. We're talking surfaces now. There's more surface within a average temporomandibular joint than there is on the surfaces of 28 teeth. With that being the case, if you have an inflamed temporomandibular joint, and let's just say it's totally inflamed, all of the surfaces are inflamed or have inflammation as a result of damage within the joint, then theoretically, or actually, if you will, then the inflammation coming from the temporomandibular joint supersedes or is greater than the influence of inflammation of periodontal disease. So why is it not extremely important, or at least equally important, to treat the inflammation of temporomandibular joint problems as it is to treat the inflammation associated with periodontal disease in its relationship to the health of the body? Now, Mr. Thorne and Pacific Dental have not made that connection yet. I would like them to make that connection, or anyone else who treats patients from a dental standpoint. Unfortunately, temporomandibular joint problems have been left in the lap of dentistry for the past 70 years. And as I've said in earlier episodes, dentistry has done a poor job. I won't leave any other expletives associated with that. A poor job of actually addressing temporomandibular joint disease like they have addressed cariology and periodontal disease and treating those diseases and others by the specialists and generalists within dentistry. The TMD has pretty much been ignored. Excluding, yes, there have been efforts in different areas, but in comparison to the efforts placed on other oral diseases and oral-related diseases, the TMD has been, other than the oral and maxillofacial surgeons who in the early 1970s began trying to treat TMD, TMJ surgically, which pretty much has been shown to be an abject failure, admittedly, and as an oral and maxillofacial surgeon, I would be the first one to admit this, having completed over 2,000 temporomandibular joint surgery cases, half of them open joint cases and half of them through an arthroscope, that the results are less than adequate, is which reason why I quit doing temporomandibular joint surgery to treat TMJ, TMD problems roughly 10 or 12 or 13 years ago. So getting back to the point, the mouth-body connection is very real. Pacific Dental has taken on the challenge of promoting and disseminating that, and specifically how the inflammation associated with periodontal disease, which a large part, 60%, I believe that was the number that I read, but a large part of the population has, to one degree or another, periodontal inflammatory damage in and around the teeth. So too, the temporomandibular joint. 45% of females have temporomandibular joint symptoms associated with inflammation associated with the temporomandibular joint. 45% of females, a lesser percent of males. The reason it is primarily females is this one fact in the literature for 60 or 70 years. Estrogen exacerbates inflammation. That's why it's a female problem primarily. You can damage the temporomandibular joint and create inflammation by bruxism, by acute trauma, and functional malocclusion. Those are the only three causes of damage within the temporomandibular joint. Bruxism, acute trauma of various kinds, and functional malocclusion. I mean, if you only address the occlusion as the cause of TMD, you're missing more than 2/3. I mean, bruxism is the primary cause. But all those are the three causes for damage. Once damaged, it creates inflammation. Once inflamed, it has a significant influence on the rest of the body. And that is a very large topic that has to do with the mechanisms of body repair, inflammatory response, endocrine response, neurochemical response, neurologic response, are all responses that have intimate parts to do with inflammation. So I'm not really getting off the topic, and I'm not going deeply into the weeds here. I hope I'm making my point that because the surface area within the temporomandibular joint is so great, greater than 28 teeth, and inflammation within the temporomandibular joint is so common, creating the symptoms of TMD, that the case needs to be made for the importance of treating TMD correctly, easily, effectively, at least as much as we put into the treatment of periodontal problems. So I think that I've made the point. There is an interprofessional practice and interprofessional relationships now forming between dentists, dental profession, dental industry, and the medical industry. And you know, it's really silly that they have separated them so greatly. But that is the way the public feels about it, and until recently, that is how the separate specialties feel about it. But at least in several areas of the country, the professions, those two professions, which I intimately know, are coming together, which makes a whole lot of sense to me as to how we should, going forward, practice our healing professions and coordinate our efforts, not only through simultaneous or similar or identical practice management systems, but to get each of our doctor groups, our specialists and our generalists, talking to one another, communicating with one another, interfacing with one another for the benefit of the patient, and then educating the patients about the importance of interprofessional practices and why it's important, and why it would be, I think, extremely successful to what Pacific Dental is doing in bringing the two professions together. All right, with that being said, I'd like to wrap it up. If you would like to comment on my episode, certainly welcome to do it, either on Dentaltown, or you can comment to me directly at my email address, which is tony@tmjservices.net. If you would like to talk to our Director of Operations and also our Director of Education, that would be Naomi@tmjservices.net. If you would like to consider learning how to treat temporomandibular joint problems, TMD/TMJ, easily, succinctly, for the benefit of your practice and the patient, you can get a lot more information by looking at our website, which is www.urbanictmj.com. We are making significant progress now in getting the word out. We will be having our first seminar, direct patient eyeball-to-eyeball seminar and training program here in Nashville, Tennessee, actually in Franklin, Brentwood, just south of Nashville, on April the 19th. It's an all-day seminar, which will teach you how to treat TMD as we do here in the founding practice for the benefit of your patients. It's an all-day seminar, and if you'd like to learn more about it, you can contact Naomi. There's 6 CME credits will go along with the seminar, and after that seminar, then you will have adequate information to be licensed and treat TMD with the Urbanic device and protocol. The Urbanic device and protocol, this little thing right here, which actually, when used correctly, if I can get it off the model, decreases inflammation within the joint predictably to the point that it makes all the symptoms go away. I look forward to the next time I can speak with you, which will again be on a Tuesday morning. I hope you have a successful week. And I would hope that if you'd like to find out more or you'd like to talk to me, I can be reached at my email address. Until then, I'm Tony Urbanic, and this is TMD Demystified.